Our goal has to be not about any particular program or any particular way of doing things. It has to be, how do we get health care to people better, faster, and cheaper? Better, faster, cheaper. These are social, moral goals. Even the cheaper. If you are spending too much money getting health care to people, you are able to serve fewer people. You are straining the economy. Why is it such a big question? Can we pay for all Americans to have health care? Because we spend so much money on it. That's why. If we could figure out how to do it cheaper, it would be a trivial problem. So how do we get there? Let's do a little arithmetic here. So I believe it can happen, and I'll tell you two basic things I believe are true. One is that the U.S. is the likely leader. Why? Because we do it so poorly. This is the place that real reform is going to begin. And the likely tool is information. Let's do the arithmetic on this. Okay? The arithmetic goes like this. If you've been a follower of the Dartmouth Group and the Rand Corporation and the work that they have done about cost and quality in healthcare, you will already know what I'm about to put up here. This is very sound information. They've done these studies over and over in a bunch of different ways, and they've involved both physicians and economists. There's little that one could doubt about this information, and it comes down to this. If you look at the most costly per case and least costly regions of the United States, you find the difference between them in cost is about 60%. If you get a cholecystectomy, if you get a new hip put in, if you get your heart replumbed or whatever you want to do, you get a new head screwed on or anything like this, in Florida, it'll cost you about 60% more than if you did it in Minnesota. And this is not just two particular states. There are wide areas of the country. Boston, Massachusetts, New York, high-cost areas. Southern California, high-cost area. Washington State, sort of low cost. The difference is 60%. Well, you'd think, you get what you pay for, right? So they're giving you more stuff down here in Florida, right? Well, yeah, because the prices are pretty much controlled. They're not charging more for the same thing so much. They're doing more stuff for you, more MRIs, more tracheotomies, more visits to specialists, whatever. Well, then people in Florida must be better off for this, right? I mean, you get what you pay for, right? The variation in outcomes is zero. Sometimes it's in fact negative. You actually get better outcomes at the places that cost less by a few percentage points. What are we to conclude from this? Well, that this extra expense could be reasonably called waste. That's a lot. So what if every place in the country somehow modeled what they were doing, say, in Minnesota? Now, is Minnesota like a terrible place to have medical things done to you? All right? Have you heard of the Mayo Clinic? What if we all modeled Minnesota? What would the savings across the country be? Well, about 30%. Now, keep in mind, this is old data. I mean, this is like 1990s, early 2000s. So we're looking at we're not looking at some whiz-bang new way of doing medical care. We're talking about the way we've always done medical care. Some places do more, some places do less. And it turns out the places that do less, you're no worse off. So you could save 30% if we all modeled the way it's done in the least expensive areas with no drop in quality. In fact, there would be an increase in quality. It's estimated some 30,000 people a year are killed by unnecessary procedures. You save 30,000 lives right off the bat. Now, how much is 30%? Well, in 2008, it is projected we're going to spend 2.4, you see that T? That's trillion. An unimaginable, mind-bogglingly big number, right? 30% of $2.4 trillion is $720 billion. I think that needs to be written a little bit bigger. 720,000,000,000, 720 billion Now, if we could somehow salvage that out of our system, could we pay for every American to have health care? I think it's about 7 times what we might need. In fact, some healthcare economists allege that it actually won't cost that much to cover all Americans because, in fact, we already take care of these people. We just take care of them in the ER when they come in diabetic shock instead of taking care of their diabetes ahead of time. So actually, it might cost less if we took care of everybody. But leaving that aside, could we take care of ourselves? Yeah, we could take care of ourselves. We could have every American. We could pay for every American's health care. Oh, and by the way, while we're at it, we could pay for Russia. And we could throw in India. Why not? It's only 1.3 billion people. We could throw in all of the Middle East. We could throw in Africa. We could throw in Eastern Europe. We could throw in Scandinavia. We could throw in all of the Americas, except for Canada. They spend too much money up there. And most of Asia. And, well, heck, we could leave out Canada, Spain, France, Italy, Germany, the Netherlands, UK, China, Japan, and Australia. Let them take care of themselves. We could pay for the entire rest of the world with what we save by not wasting money on things we don't need. Wow. Now, as I say, keep in mind, this is doing medicine the way we've always done it before, just imitating the places that do it somewhat more efficiently. There are many things we've done in other industries that we haven't done yet in healthcare. And we could imagine if we did them, we could drive down the cost even more. If we began to ask, how can we do this better, faster, cheaper, it is easy to imagine that we can in fact cut the cost not by 30%, but by 50%. I want you to think about how you got here. Unless you drove here. You bought a ticket. How many people had their ticket made out for them by an agent? I see one hand. How many people did it by some kind of computer? Right. How different is that from 10, 15 years ago? The kiosks at the airport. When did they go in? Now, did those systems go in because the airlines were in love with technology and they were flush with cash? They went in because the airlines were suffering. In fact, most of them were bankrupt at the very time they put those systems in. Why? Because the cost differential between you walking up to a kiosk and getting your seat and you having an agent do it is approximately 50 times. Now, that's just one example. Happens in all kinds of industries, happens all over the place. If we think of healthcare as that moment between the doctor and the nurse and the patient, that clinical moment, that moment of human judgment. But in fact, healthcare is a mass of transactions that's much, much larger than that. That moment of clinical judgment is maybe 1% or less of healthcare. If we took everything in healthcare that could possibly be done by a machine, from waxing the floors to watching the entrances to adding up the bills, everything, and had it done by machines, as they do in other industries, and left for the humans the things that humans are really good at, that we really want humans at, we would find not only a great decrease in transactional costs, we would find a tremendous increase in the amount of time that a doctor or a nurse can actually spend with a patient, helping them be healthy. So automate everything, measure everything. We have not yet done that in healthcare. So when I say we could cut the cost of healthcare in the United States by 50% and drive up quality at the same time, there's no reason to doubt it.